Welcome to our Focus on High-Risk Drugs video, brought to you by Greenlight Campus. Today we'll be talking about methotrexate. Methotrexate is an immunosuppressant. It slows down your body's immune system and helps reduce inflammation. It is used to treat autoimmune and inflammatory conditions. It is currently used to treat rheumatoid arthritis, Crohn's disease, and psoriasis. It is currently available as an oral tablet, an oral solution, or as an injection formulation. A key thing to remember about methotrexate is that it has a once-weekly dosing. It is important to take your dose on the same day each week. A patient will be co-prescribed folic acid whilst taking methotrexate. Folic acid helps protect the healthy cells in the body and reduces some of the side effects of methotrexate. The dose of folic acid a patient takes will vary from once a week to 6 days a week. Do not take folic acid on the same day as methotrexate, as it can stop the medicine from working properly. Before and during treatment, patients will have regular blood tests. When first starting treatment, patients will have checkups and blood tests every 1 to 2 weeks until stable. Then it will be monthly for the first 3 months, then every 12 weeks. The doctor or pharmacist will monitor full blood count and check for renal and liver function. The prescriber may then increase or decrease the methotrexate dose depending on the results of the test. It is important to remind patients to record how much methotrexate they take and the results of their blood tests. They will usually be given a methotrexate booklet for this. Like all medicines, methotrexate can have side effects, although not everyone gets them. Some common side effects of methotrexate include loss of appetite, feeling or being sick, stomachache, indigestion, and diarrhea. Some patients may also experience headaches or joint and muscle pains. They may also feel tired or sleepy. Serious side effects are rare, but a patient must inform a healthcare professional immediately if they get any of the following symptoms. This includes yellowing of the skin and whites of the eyes, as these may be signs of liver problems. They may experience a persistent cough, chest pains, difficulty breathing, or become breathless. These may be signs of inflammation of the lungs. They may also have swollen hands, ankles, or feet and experience changes to how often they pee or not peeing at all. These may be signs of kidney problems. The patient might also have a high temperature, chills, muscle aches, and sore throat. These may be signs of an infection. They may also experience bleeding gums, blood in the pee, vomiting blood, or unexplained bruising. These may be signs of a blood disorder. They may also notice a severe skin rash or blisters on the skin, mouth, eyes, or genitals. These may be signs of Stevens-Johnson syndrome. Some medicines should be avoided when a patient is taking methotrexate. Taking these medicines whilst taking methotrexate will increase the risk of toxicity and increase side effects. Before dispensing, check for any interactions. I will list some interactions, but this is not an exhaustive list. Patients who are taking methotrexate should avoid taking non-steroidal anti-inflammatories, NSAIDs, such as over-the-counter ibuprofen and aspirin. Antibiotics such as clotrimazole and trimethoprim. Medicines used to treat epilepsy such as levetiracetam. Medicines used to treat indigestion such as omeprazole. Patients should also avoid having live vaccines administered whilst taking methotrexate. This includes the yellow fever vaccine and the MMR vaccine. Methotrexate must be avoided in pregnancy and breastfeeding. This is because methotrexate is a teratogenic drug, which means it can disturb the development of the baby. Before initiating treatment, pregnancy must be excluded, and effective contraception must be used during and for at least 3 months after treatment finishes in both men and women.